Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on bronchi. Now, first of all, the name of the title. Many times we are pronouncing this title as bronchi, but actually we should pronounce this as bronchi. So it is not bronchi, actually it is the bronchi. Now, we know in our respiratory tract we are having the trachea, and this trachea is dividing at the superior border of fifth thoracic vertebra into two branches, the left branch and the right branch, and both these branches, the left one and the right one, these branches, they are going inside the left and right lung, and these branches are known as right main bronchus, which goes into the right lung, and this right main bronchus is also known as the primary bronchus. Bronchus means the windpipe. Then we are having on left side the second branch, that is the left main bronchus or the left primary bronchus, which enters into the left lung. So here you see in the figure, this one is the trachea, okay, and this trachea, you see over here it is bifurcating. So it is bifurcating into two branch. This one is the right main bronchi, and this one is the left main bronchi. Now you observe this, okay, this closely. There is a reason why I'm telling you, you observe this. So as we have seen that the right main bronchus is more vertical, slightly upward, then it is shorter one, and it is the wider one than the left main bronchus. So once again I am showing you, okay, shorter, this one is the shorter, wider and vertical than the left one, okay. And this is the reason, since the right main bronchus is wider than the left one, so what happened, the air which we inspire, okay, that atmospheric air is more likely to enter into the right lung, okay. So we can say the right lung is getting the more inhaled or aspirated objects, okay, than the left one, because the diameter of the right main bronchus is more wider, that's why. Now similar to the trachea, the main bronchi, the right and left one, they are also having the incomplete ring of the cartilage, and inside this bronchi, the lumen of the bronchi lined by ciliated pseudo stratified columnar epithelium. So the lumen, around the lumen, the epithelial cellular layer is present, and the cells which are present are the ciliated pseudo stratified columnar epithelial cell. So in the figure I am showing you this thing. For example, over here you see the trachea is shown, okay, this one is the trachea, and this branch, okay, this branch is the left main bronchus, and this branch is the right main bronchus. So we are having two lung, okay, the left one and the right one. And here you can see in the left lung there are two lobes, one is superior lobe and one is inferior lobe, and in the right lung there are three lobes, superior lobe, middle lobe and the inferior lobe. So here you see this one is the superior lobe, inferior lobe, and over here superior, middle, inferior lobe. Okay, so in short, left lung two lobe, right lung there are three lobe. So now moving on the second point of our discussion. Now at the point where the trachea divides, that means at the point from which the trachea bifurcate into two branches, the left and right main bronchi, there is one internal ridge is present, and this internal ridge is known as the carina, and carina means keel of boat. So here in the figure I am showing you, here you see the trachea is shown. This is the trachea is shown, and here the trachea is bifurcating. Trachea is dividing into two branch. So at this juncture, okay, the carina is present. Okay, so you see where exactly carina is there. And what is this carina and how it is formed? So it is formed by the posterior and somewhat the inferior projection of the last tracheal cartilage, and the mucous membrane of the carina is one of the most sensitive areas of the entire larynx and the trachea. Okay, so any unwanted substances in the inhaled air, let's say the smoke or the dust particle or the allergic substances, what happens, the mucous membrane of the carina triggers and it produces the coughing reflex. Okay, so when some unwanted substances when we are inhaling them, so there is a triggering of this cough reflex and we will start the coughing, okay, due to the carina. Now if in someone's body, let's say in the patient's body, if the carina has widened up or the distorted means the shape of the original shape of the carina, if it is changed, then it is the serious sign, and this serious sign that is indicating that there is a carcinoma of the lymph node. Okay, and where this carcinoma or this cancer is present, so this cancer is present at the region where the trachea is dividing. Okay, so this is about the carina. Now the third point. Now what happens to left and see in left lung left main bronchi enters, and in the right lung right main bronchi enters. So after entering both the lung, what is happening, so this main bronchi, they further divide into smaller bronchi. and this smaller bronchi, they are known as the lobar or the secondary bronchi. Okay, and this lobar or the secondary bronchi, they are one for each lobe of the lung. And here we are remembering that the right lung has 3 lobes and the left lung has 2. So now in the figure we are seeing this. So here you see what is happening. This one is the right main bronchus. This is the superior lobe, this is the inferior lobe of the lung. So this right main bronchus is bifurcating in 2 branches. So one branch is known as left superior lobar bronchus. So this one is left superior lobar bronchus, and this one is the left inferior lobar bronchus. Then over here, this one is the right main bronchus, and from this right main bronchus there arise in the right lobe one branch is going. So from the right main bronchus, as you can see, this branch is going into right lobe, so this branch is known as the right superior lobar bronchus. Then this branch, so this is the intermediate bronchus, and then intermediate bronchus bifurcate into 2 branches. So this new 2 branch, one branch is going into middle lobe, so that is known as the right middle lobar bronchus, and the final one which is going in the third or the final or the inferior lobe of right lung, that branch is known as the right lobar bronchus. So you observe this entire figure. Okay. One more figure. Okay. So sometimes you will find in different book they are naming differently. Slight variation for the naming is used. For example, in the histology book you will find this is the trachea and these are the 2 branches. So left primary bronchus, okay, and they are writing right primary bronchus, and in some book left and right bronchi they are writing. Okay, so both the names are valid. Now what is happening to this left primary bronchus? So it is dividing into 2 branch, okay, this one and this one. So left lung is having 2 lobes, so this new branch, now it is known as left superior secondary bronchus, and this branch, okay, so this branch is known as left interior. So see, because it is going to inferior lobe, so it is known as left inferior secondary bronchus. Okay, and here also you see this is the right primary bronchus. From this one branch is coming out. Okay, so this branch is right superior secondary bronchus. Okay, then this is intermediate bronchus, and then intermediate further divides into 2, so that is right middle secondary bronchus, and then right inferior secondary bronchus. So you observe this figure. Now moving on the third point of our, we have completed the third point of discussion. Now we are moving on the fourth point of our discussion. So what is happening actually? You see, see over here one small table is given. So with this table you will get the idea what actually is happening. So we have started with the trachea. Trachea divides and there is a formation of main bronchi, left and right one, which is which is entering into left and right lung. Then this main bronchi, they divide into lobar bronchi. So in the left lung there are two lobar, and in the right one there are three lobar bronchi. Then lobar bronchi, they further divide into smaller branches, and these smaller branches are known as the segmental bronchi. Then this segmental bronchi further divide into still smaller branches, and these smaller branches are known as the branchiole, and the branchiole further divides into smaller branches, and then there is a formation of terminal bronchiole. Okay, so this theory point, if you prepare this way, so this theory point this theory point explains this thing. Okay, now here you see, for example you see right main bronchus. Okay, right main bronchus, then it is divided into right, this one is the right lobular bronchus. Then we are having, from this lobular bronchus there are branches known as right segmental bronchus. Then right segmental bronchus divides into many branches, they are known as right bronchiole. Then from right bronchiole still smaller branches arises, so they are known as right terminal bronchiole. And you see the the right terminal bronchiole, these are the very tiny one, है ना? So now moving on to fifth point. Now here one diagram is there. Now you read the title of diagram. What is this figure? So diagram of a terminal bronchiolar epithelium. Terminal bronchiolar, very tiny one. Okay, so in the lumen, around the lumen, the epithelial cell are present, and in that epithelium, which type of cell are present? So in the epithelium of the terminal bronchiole, you see there the brush cell are present, the clara cell are present. Okay, then granule cell are present, and the ciliated cell are also present. Now, what is the role this clara cell are playing? So the clara cell, which are present in the epithelium of the bronchiole, the terminal bronchiole, they are also known as the club cell, and this cell are the columnar, non-ciliated, means cilia are not present on the surface, so they are columnar non-ciliated cell, and they intersperse among the epithelial cell. So in between the epithelial cell, the clara cells are present. And what is the role, what is the function of this club cell? So in the atmospheric air that we are inhaling, some harmful substances, let's say the toxic substances or the carcinogens are present sometime. Okay, so this to give our body the protection against this toxic or the harmful substances or the carcinogen substances, this clara cell, they secrete, they produce the surface active agent, and this surface active agent are known as the surfactant. Okay, and this how this surfactant they are protecting against the carcinogen and the toxin. So that discussion is not in your syllabus, so we are not discussing that thing. Okay, then this club cell or the clara cell, they also function as the stem cell or the reserve cell, and whenever requirement this cell, clara cell, they will give rise to some other cells of the epithelium as per the requirement. So this was the fifth point. The sixth point. Now after, see here, these are the, you can see these are the terminal bronchiole, only the terminal bronchiole is shown in the figure. Okay, so it is not that with this the bronchioles are ending. This terminal bronchiole still further divide into very tiny, very minute, very smaller one bronchiole are still arising. Okay, in very small bronchiole, they are now known as the respiratory bronchiole. So first of all, we can divide this entire pathway into two zones. One is the conducting zone and the second one is the respiratory zone. So what are these two zones? So see, so when there is a formation, of terminal bronchiole in the lung, so at this point where the terminal bronchioles are present, this zone is known as the conducting zone. So you can understand we have started from trachea, then the left and right main bronchi, then the segmental bronchi, then there are some more branches. Okay, lobar, segmental, then the bronchiole, then the terminal bronchiole. Okay, so all this part, this entire, so this up to here in the figure, if you see, we have started with this. So all this region up to here, this part, this region, we can say this is the conducting zone, or this region, this entire region is the conducting zone. Now see what happened. You see there is a extensive branching from the trachea. So many branches has now emerged, and now all these branches together, when we look at them, they look like the inverted tree, and this inverted tree is referred as the bronchial tree. So here you see, if you observe closely, see all these branches, okay, so together all this branch, they look like the inverted tree. Okay, so this inverted tree is known as the bronchial tree. Now the beyond the terminal bronchiole of the bronchial tree, as I told you earlier, still some small branches which are the very very minute and the microscopic one. So that means we cannot see them with our naked eye. So this microscopic bronchiole are known as the respiratory bronchiole. So here you see in the table, with the terminal bronchiole, there is an end of a conducting zone, and from this terminal bronchiole, still very minute bronchioles are arising. So these minute bronchioles, which are the microscopic one, these are known as the respiratory bronchiole. And from this respiratory bronchiole, still small minute bronchioles are arising, and as you can see, these bronchioles are going inside the alveolar sac. So these are known as the alveolar duct. So alveolar duct, we can say, they branch off from the respiratory bronchiole, and they are entering into the alveoli. Okay. So this is the sixth point of our discussion. Now here you see one table is given, and this is our seventh point of discussion. So here in the seventh point, something related to generation is written. Now what is the meaning of this generation? What they are saying is that, see, trachea, we are starting the entire branchial tree with the trachea. Okay, so the trachea is the generation 0. Okay, from trachea is divided into left and right main bronchi. So left and right main bronchi is the first generation. Then let's say this left main bronchi is further divided into lobar okay, superior and inferior lobar bronchi. Then from lobar bronchi, then there arise the segmental bronchi. So this will happen, this branching will happen up to second to 10th generation. Okay, then after the 10th generation, the segmental bronchi, they are further dividing into bronchiole, and the bronchiole will divide into terminal bronchiole. So from bronchiole to terminal bronchiole, there are 11 to 16 generation. Okay, and between the terminal bronchiole and the respiratory bronchiole, there are 17 to 19. So this respiratory bronchiole, 17 to 19, 17, 18 and 19. Okay, then 20 and 20, 21, 20, 21 and 22, there are the alveolar duct. And on generation 23, so there comes the alveolar sac. So we can understand this way, that then trachea is at 0, then branch number 1, 2, 3, 4, 5, 6, 7, and we are branching, and finally the last branch, okay, will enter the 22 alveolar duct. Okay, and at the end there is the alveolar sac is present. So alveolar sac is present on the generation number 23. So that is the meaning of this thing, and I'm showing you this this entire figure is very important for you. So you go through this figure. Now we are discussing the point number 8. Now here we are in the various kind, we know in the respiratory system there are various kind of bronchioles, and in the lumen, around the lumen of this bronchiole, various kind of epithelial cells are present. So first, in the theory point, I am explaining this, that which kind of cell are present in the epithelium, and then I will show you the histology slide so that you will get the idea. First, let's discuss this point number 8, which type of cells are there in the epithelium. So you see here, ciliated pseudo stratified columnar epithelium in the main bronchi. This you are remembering, okay? In the main bronchi, ciliated pseudo stratified columnar epithelium. lobar bronchi and the segmental bronchi. Then ciliated simple columnar epithelial with the goblet cell in the large bronchiole. Okay, ciliated simple columnar epithelium with some goblet cell in the large bronchiole. Then ciliated simple cuboidal epithelium with no goblet cell in smaller bronchiole. Then non-ciliated simple cuboidal epithelium in terminal bronchiole. Okay, so I know it is a bit difficult for you to remember, but I will show you some histological slide so that you can understand this thing. So for example, see, this is the respiratory bronchiole they are showing. Then you see the alveolar duct, lung alveoli. Okay, and here you see in the bronchiole, in the epithelium, simple cuboidal epithelium is there. Okay, so you prepare this slide, all the names. Then this one, terminal bronchiole, transverse section, and the simple columnar epithelial cell. Then the intrapulmonary bronchus, transverse section. Okay, all the names you see, this duct and the gland, seromucous bronchial gland with the axillary duct, which is pouring the mucus in the lumen. Okay, hyaline cartilage and everything, smooth muscle, artery, bronchial blood vessel, vein, lamina propria, bronchial epithelium, seromucous bronchial gland. Okay, this is also the histological slide. Okay, then bronchiole, bronchial wall, tertiary bronchus, segmental bronchus. Okay. Now, in our entire respiratory tract, around the lumen, the epithelium, which is there. So in the epithelial cell, for example, here you see the epithelial shell are shown, and on the surface of this epithelial cell, the cilia are present. Okay, now between the epithelial cell you see the goblet cell are also present, and with the red arrow what they are showing that this goblet cell, they produce the mucus. Okay, now the atmospheric air that we inhale, in that air there are the dust particle are present. Okay, sometimes the fine coal dust is present. Okay, and it is possible that if someone is smoking close to us, then the smoke of the cigarette, so the smoke particle, they are trying to reach the alveoli. That means they are trying to enter into deep into our lung. But what happens in between in this epithelium, as we are now knowing that this goblet cell, they are secreting the mucus. So the dust particle or the coal dust or the cigarette smoke dust or the cigarette smoke particle, they stick to this mucus. Okay, and the cilia are continuously beating. Okay, so the cilia is pushing this mucus, which is having the dust particle and some other varieties. So all this they are pushing towards the pharynx. Then from the pharynx, the mucus and the dust particle will enter into nasal chamber, and from the we are having the nostril or the nares. So from the nares or the nostril, we will remove this mucus along with the dust to outside. Okay, so now we are discussing the ninth point. So in the ninth point, see, uh, cartilage uh, cartilage are there. We know the cartilages ring are there in the trachea and the left and right main bronchi. They are having the cartilaginous ring, incomplete one. Okay, but what happened, the gradually, as the branches are becoming smaller and smaller, this cartilaginous ring, they are disappearing, and at the distal bronchiole they completely disappear. Okay, so in the figure I am showing you, as you can see over here, in the cartilage, incomplete cartilage, C-shaped ring is there. Now these rings are also present in the main bronchus, left and right. And then you see in the from the lower bronchus onwards, what is happening? So instead of incomplete cartilage, now there is the cartilage plates are present, and these cartilage plates, when there is a smaller branch formation, let's say on the surface of bronchiole, so this cartilage plates are absent. Okay, and in this bronchiole there are more muscles are present, the muscle that are the smooth muscle. So more smooth muscle are present. So this is the one figure, you observe this figure, and if you are interested all this information you can read. And this one and this figure. Okay, so here you see what is happening, the cartilages become sparse. Okay, here you see, here you are fine, the cartilage plates are present, but they are becoming very thinner one. Okay, and mostly they are present at the point of branching, and then at the level of bronchiole the cartilage are completely disappeared. So in all this bronchiole, terminal, respiratory, there are more muscle, the smooth muscles are present. Okay, so this is also one good figure, one important figure for you. Okay, now we are discussing the 10th point. Now in the 10th point, what is written, that now in the bronchioles, what happens, the amount of cartilage has decreased. Okay, and the amount of smooth muscle, as I told you earlier, increases. Now what this smooth muscle are doing, so they are present around the lumen, that means they are encircling the lumen and they are present in the form of the spiral bend. And what this smooth muscle are doing, so they are helping to maintain the patency means they are keeping the respiratory tract open for this bronchiole, and we know this final bronchiole, this the respiratory bronchiole, they are the very tiny one, they are microscopic, and that's why, because they are supplying the oxygen to the alveoli, and from the alveoli the CO2 is going to enter in the respiratory bronchiole. So that's why it is very important to keep them keep them open. Okay, and this smooth muscle, they are keeping them open. Now because there is no supporting cartilage, muscle spasm, muscle spasm can close off the airway. So muscle spasm means the sudden contraction of the smooth muscle in the wall of the respiratory bronchiole. So if the muscles are contracted and if they are closing this air path, so what happen, the oxygen will not be able to enter into the alveoli, okay, or the CO2 cannot enter into the respiratory bronchiole. So this is the critical situation, and the person can suffer from the asthma attack. Okay, and this asthma attack can be a life threatening situation, because the oxygen and the CO2 exchange is not occurring between the alveoli and the blood capillary. That's why, because the oxygen is not reaching into the alveoli. So this is the 10th point of our discussion. Now we are on the final point of our discussion, point number 11. Now when the person is doing the exercise, uh, let's say in the gym or any form of exercise, aerobic or the yoga or cycling or running or the cardio, any type of exercise, when the person performs, what happens, the sympathetic division of the ANS becomes active, and this ANS activity increases, sympathetic division activity increases, and the adrenal medulla releases the hormone epinephrine and norepinephrine, and both this activity, one activity is that when we are exercising, one thing, the sympathetic division is activated, second thing, adrenal medulla is releasing epinephrine and norepinephrine. Now both this activity, what they are doing, what they are causing, so they are causing the relaxation of the smooth muscle in the bronchiole. Okay, so the air path is open when we are exercising, and this is very helpful, because oxygen can easily enter into the alveoli, and some good gas exchange can occur in the wall of alveoli and between the capillary wall. Okay, so that is the respiratory membrane. Now because the air reaches the alveoli more quickly when we are exercising, so there is so lung ventilation also improves. Now when the parasympathetic division of ANS is activated, okay, or under some allergic condition, okay, so under allergic condition, histamine is produced. Okay, so now there is the opposite effect that we have discussed in the during exercise. It was helpful, but if in some condition, if parasympathetic division activity increases, or due to allergic reactions more histamine is produced, so opposite effect are going to take place. Now what are these opposite effect? So this opposite effect will cause the contraction of the bronchiole smooth muscle, so the air passage is blocked. Now the very less amount of oxygen can enter in the alveoli, and less exchange of O2 CO2 between the alveoli and the blood capillary. Okay, so this condition is also very critical one, very dangerous one. Okay, so with this we have completed this presentation lecture on bronchi. I hope you enjoyed this presentation lecture, and I also hope that this presentation lecture will be helpful in your exam preparation and also in your studies. My name is Manish Kushti sir. I am from Ahmedabad, India. Bye bye. Namaste.